A very good morning, students. This is your teacher Neelam Helawat, and today we'll continue our chapter, that is chapter number 2. This is a lecture number 2, dear students. In the previous lecture, we have talked about, we've spoken about the different methods of contraception and what are their different, you can say, disadvantages, what are their side effects. So, and today we'll be talking about the medical termination of pregnancy, that is MTP. Okay, so let's start with the topic, dear students. So, medical termination of pregnancy. The medical termination of pregnancy, it is also abbreviated as MTP. Okay, what do you understand from this word? What does this word means? Right, this is also another way of calling it is induced abortion. You can call it with another name, which is called induced abortion. Right, everyone? So it is basically the intentional or the voluntary termination of the pregnancy. मतलब अगर couple चाहता है, mother चाहती है कि ये pregnancy she don't want to carry it, so in that case she goes for the abortion process. She can terminate this pregnancy. In India, approximately, if I talk about, in terms of all over the world, 45 to 50 million MTPs are performed every year. And this is approximately 1/5 of the total pregnancies that are conceived in a year. So out of 5, first is the abortion process which is there. So out of the total pregnancies taken all over the world, 1/5 are the total conceived pregnancy. They go for the abortion process, and we can say they have not planned this child, right? They go for the abortion then. So MTP decreases the population, though it is not meant for this purpose. So MTP से 100% हमारी population decline होती है, लेकिन MTP is not meant for this purpose, right? Clear? Because there is still a debatable question, and it's debated in many countries because in this process there are a lot of emotional, ethical and regional and social issues are associated with it. Okay, as I was talking about, there's a lot of emotional, ethical and religious and social issues that many countries raise regarding the MTP. Now, this government of India has legalized this induced abortion in 1971. So, in India, this process has been legalized with some strict conditions to avoid its misuse. Okay, the government of India has certain strict rules so that it could not be misused. Okay, and such restriction are to check the indiscriminate and illegal female feticides. See, dear students, we know that India is known for its killings of female feticides. So there are chances that people may use this method. First, they will detect with the help of amniocentesis technique. First, they will detect the sex of the child, and then they will go for the induced abortion. So this technique, keeping in mind this intention of the parents, the government has some strict actions or strict procedures. Then only the couple can go for the induced abortion. Now, coming to the importance of medically termination of pregnancy. First of all, it is there to avoid unwanted pregnancies or due to some casual intercourse or the failure of contraception. If there is any pregnancy that has occurred due to the unprotected intercourse, right, or maybe due to a rape, pregnancy has occurred. So this abortion can be used to avoid the mental trauma that the child can undergo from such a pregnancy. So medical termination is, you can say, in certain cases it is very, very essential, because this continuation of pregnancy can lead to the harmful to the mother and as well as to the fetus and or to the both. Okay, and these MTPs, they are safer to be relatively safer if they are carried in the first trimester. Means अगर आप पहले 3 months में ये कराते हैं, abortion कराते हैं, that is quite safer. So the 12 weeks of pregnancy, up to 12 weeks of pregnancy, it is quite safer. While in second trimester, it is much more riskier. Okay. Then coming to the problems that are related with MTPs. First of all, majority of the MTPs they are performed illegally. जितनी भी MTPs perform की जाती हैं उसमें से ज़्यादातर illegally की जाती हैं, okay, which are either unsafe and they could be fatal also. Secondly, misuse of amniocentesis technique is done. Means first the couples will detect the sex of the child, and when they come to know that the child is a female, then they go for the MTP. So which is totally against, or it is illegal to kill the female child only. Okay. Then because in case of female only the MTP process is performed, so it is totally illegal. The government has not said that in case of female child you should go for the abortion. The government has strict rules. Government only said you can go for the MTP only if the pregnancy is not a planned one. So we need to effectively counsel the parents regarding this issue, and we should tell them the risk factors which are involved in the illegal abortions, as well as we need to provide them proper healthcare facilities so that it is not burden on them, right? So, and they should minimize the use of MTPs. They should go for the planning work first, so there is no need for the abortion later on. Coming to the sexually transmitting diseases, everyone, we know there are certain diseases which are transmitted when the couple have intercourse and it is not a safer one. So STDs, that is sexually transmitting diseases. Let's understand what they actually are. So sexually transmitting diseases, they are basically transmitted through sexual intercourse. Okay, the diseases that are transmitted through the sexual intercourse, they are called as sexually transmitted diseases. They are also called as vulnerable diseases, or they are also called as reproductive tract infections. So we can call them with three names. One is STD, second is VD, and third is RTI. So we should remember all the three names because the question can use any type of name. And the examples of these are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV that can later lead to the AIDS. Now, sexually transmitting diseases. Now, some of these infections, like, as I told you, hepatitis B and HIV, they are also transmitted by the following methods. First, by sharing of injection needles or the surgical instruments. Secondly, by transfusion of blood. Or third, from infected mother to the fetus. Okay. Except for hepatitis B, genital herpes, and AIDS, other diseases are curable. So except for these three diseases that we are talking about, hepatitis B, HIV, AIDS, and the genital herpes, other diseases, they are completely curable if they are detected at an early stage and they are treated properly. Okay. So we should not hide if we have any sexual transmitted disease. We require a proper consultation and a proper medication. We can be properly cured. Then is sexually transmitted diseases. What are the various symptoms from which we can identify that we are basically suffering from the sexually transmitted diseases? The early symptoms includes itching, fluid discharge, slight pain or swellings in the genital region. If any of these symptoms are available in the genital region, we must consult the doctor. Then there is absence or less significant symptoms in the early stages of infection. Okay, we should be very peculiar in detecting these symptoms, and later on, if we are later on stages, they could be they could lead to complications, which can include the pelvic inflammatory diseases. Okay, this could later lead to pelvic inflammatory diseases. That is your PID. What is PID? Pelvic inflammatory diseases, abortions, stillbirths, and the ectopic pregnancies, and sometimes even cancer of the genital tract. So we should be very, very careful. We should detect the symptoms and consult the proper doctor related with that issue. Okay, we should not hide. Clear? All persons are vulnerable to STDs. Right? All persons, they are vulnerable to STDs. It is not only that a section of are there, all are vulnerable. Okay, and especially those who belong to the age group 15 to 24. तो जो लोग इस एज ग्रुप में आते हैं, they are highly vulnerable. So there is no reason to panic because prevention is possible. We should go for the prevention, right? And one could be free from these infections by following the simple principles, right? We can be free, we can avoid such diseases, but we need to follow certain basic principles. See, we always need to keep in mind that people should avoid sex with unknown partner or the multiple partner. This is the first, you can say, precaution that we need to follow. Second, always use condoms during the sexual intercourse. Third, in case of any doubt, one should consult the qualified doctor for the detection and then for the complete treatment if one is being diagnosed with infection. So prevention is better than cure. We should follow this simple principle. Then coming to the concept of infertility and assisted reproductive technologies, right? What does infertility means? Infertility means it is the ability of a male or female to produce children. Means we know that there is a coitus, there is a mating between the male and female. Sperms will be transferred into the female body, and if there is fertilization, that will result in the conception. But even after repeated attempts, the couple is trying to have child but they are unable to have child. This could lead to infertility. This is a problem that they are having, the infertility. That is, they are unable to produce children in spite of unprotected sex. So there are many reasons for this. This could be any physical reason, there could be any genital disease, there could be some drugs, or there could be some psychological, you can say, reason. So specialized healthcare units that deals with the infertility you can say part, they should the person should go to them, get himself diagnosed, and then get the corrective treatment so that this particular disorder can be removed. Okay, clear? Right. And if there is any even then, if there is any problem which cannot be corrected, then they could go for the techniques which are called as ART, that is assisted reproductive technologies. Okay, assisted reproductive technologies. So we have a various techniques that comes under the ART. So first is, like I'm dealing with it, gamete intrafallopian transfer, which is called GIFT. Then you have intracytoplasmic sperm injection, which is called ICSI. Artificial insemination techniques, that is AI. Surrogacy, in vitro fertilization, or a test tube baby program. So a couple can decide whichever technique they want to opt and can go for the detection, right? So let's discuss each category separately. Now first is first technique in the ART is test tube baby or in vitro fertilization. Now in this method, ova from the wife, okay, ova from the wife and sperm from the husband, that are both are collected, and they in the lab they are induced to form the zygote. Okay, clear? Is it clear? So from the female the egg is taken, and from the male the sperm is taken. Then both they are fused to form the zygote. Okay, under the stimulated laboratory conditions, it will form the zygote. Okay, and then it will develop the embryo, and then we perform an embryo transfer technique. Okay, embryo transfer technique. फिर फीमेल के अंदर एम्ब्रियो ट्रांसप्लांट कर दिया जाता है. फीमेल से हमने एग को रिमूव किया, मेल से हमने स्पर्म को रिमूव किया. लेबोरेटरी में हम दोनों को कंडीशंस प्रोवाइड करते हैं जिससे मेल स्पर्म जो एग को फ्यूज़ कर सके, जाइगोट फॉर्म हो, उसके बाद एम्ब्रियो फॉर्म हो, और फिर हम एम्ब्रियो को ट्रांसफ़र करते हैं, ठीक है, एम्ब्रियो को हम ट्रांसफ़र करते हैं फीमेल के अंदर सो दैट इट कैन स्टार्ट द ग्रोथ, राइट। नाउ दिस टेक्निक कुड बी ऑफ टू टाइप्स, वन इज जिफ्ट, अनदर इज आईयूटी, ठीक है। अगर नाउ इन दिस केस, जैसे हमने कहा कि स्पर्म और एग को हमने फ्यूज़ कराया और जाइगोट बन गया, तो हम जाइगोट को प्लांट कर सकते हैं फेलोपियन ट्यूब में, तो उस टेक्निक को हम कहेंगे जिफ्ट, ठीक है। स्पर्म और एग फ्यूज़ कराया हमने लैब में, जाइगोट बनाया और जाइगोट को हमने मदर के अंदर इंड्यूस कर दिया, फेलोपियन ट्यूब में इंसर्ट कर दिया, तो हम इस टेक्निक को जिफ्ट कहेंगे। सेकेंड, अगर हम एम्ब्रियो को इंजेक्ट करते हैं यूट्रस के अंदर, ठीक है, अगर हम जाइगोट को इंड्यूस करते हैं तो हम फेलोपियन ट्यूब में इंड्यूस करेंगे, और अगर हम एम्ब्रियो को इंड्यूस करते हैं तो हम यूट्रस में प्लांट करेंगे। सो देन इन दैट टेक्निक वी कॉल इट एज इंट्रा यूट्राइन ट्रांसफर। ओके, क्लियर? Okay, clear everyone? So this is called your in vitro fertilization or a test tube baby. Clear everyone? Okay. Now sometimes the embryos which are formed by in vivo fertilization, that is when the fertilization occurs in the female body, okay, they could also be transferred to other females who are not conceiving, ठीक है। एक फीमेल के अंदर हमने बॉडी के अंदर हमने फ्यूजन कराया स्पर्म और एग का, और हमने जाइगोट तक उसे डेवलप होने दिया, एंड जाइगोट को फिर निकाला और अनदर लेडी में ट्रांसफ़र कर दिया, हु द वन हु इज़ नॉट एबल टू कंसीव। सो इन दैट वी कैन हैव इन वीवो फर्टिलाइजेशन। सो वी कैन हैव टू वेज, in vitro fertilization and second is in vivo fertilization. Second is gamete intrafallopian transfer. Now in this technique what has happened, there is ovum, हम एक डोनर है, डोनर से हम ओवम को रिमूव कराते हैं, ठीक है। इज इट क्लियर? सपोज करिए दिस इज फीमेल, देयर इज ए, दिस इज अ फीमेल, राइट। अब इस फीमेल की बॉडी से हम ओवम को रिमूव करते हैं। नाउ शी इज अ डोनर, ठीक है। एक फीमेल है, उनकी फीमेल बॉडी में से हमने ओवम रिमूव कराया फेलोपियन ट्यूब में से, एंड हमने अनदर फीमेल के अंदर इंड्यूस कर दिया, फीमेल नंबर 2 में। सो हमने ओवम रिमूव किया और उसे अनदर फीमेल के अंदर प्लांट करा दिया, ठीक है, सो दैट इट कैन बी फर्टिलाइज्ड एंड डेवलप्ड। क्लियर? सो दिस इज कॉल्ड गिफ्ट, gamete intrafallopian transfer, right? Next is intracytoplasmic sperm injection. Next is intracytoplasmic sperm injection. Now this is another procedure in which sperm is directly injected into the ovum. अब इसमें हम क्या करते हैं कि हमने sperm निकाला, ठीक है। सपोज देर इज़ अ फीमेल, इसमें हम क्या करेंगे, मेल से हमने स्पर्म रिमूव कराया, ठीक है। जस्ट अंडरस्टैंड वेरी वेरी केयरफुली, हमने स्पर्म मेल की बॉडी से हमने स्पर्म लिया, तो वी कैन हैव अ डोनर और वी कैन हैव द, यू कैन सी द मेल और द फादर। हमने फादर में से स्पर्म रिमूव कराया और इस स्पर्म को हमने डायरेक्टली एग के साथ फ्यूज़ करा दिया, राइट। इज इट क्लियर? समझ आ रही है मेरी बात? हमने मेल में से स्पर्म रिमूव किया और उस स्पर्म को डायरेक्टली हमने एग के साथ, एग के साइटोप्लाज्म में इंड्यूस कर दिया, ठीक है। इंसेमिनेशन नहीं होने दिया, बट हमने डायरेक्टली उसको रिलीज करा दिया, ठीक है। नाउ दिस टेक्निक इज हाईली यूजफुल इन दोज मेल्स विच आर अनेबल टू इंसेमिनेट इन द फीमेल बॉडी और दोज हु आर हैविंग द लो स्पर्म काउंट। ओके, क्लियर है? So this technique is highly used in those cases. Then is artificial insemination. इसमें हम क्या करते हैं, मेल से सीमन को कलेक्ट करते हैं और उसे फीमेल की वेजाइना में डायरेक्टली इंड्यूस करा देते हैं। क्लियर? हमने मेल में से सीमन कलेक्ट किया और फीमेल की वेजाइना में उसे इंड्यूस कर दिया। सो दिस टेक्निक इज कॉल्ड आर्टिफिशियल इंसेमिनेशन टेक्निक। Then lastly we have the surrogacy. Surrogacy में हम क्या होता है, a woman will bear a child for the couple. Suppose there is A and B. This A is a female and this is male. They are husband wife. So another female will be involved in this case. Since the female is not able to carry the child or she is infertile, so what will happen? The sperms from the male, they will be induced into another female. She will have the fertilization and then the conception, and she will carry the child for this couple. As you have heard about that Shilpa Shetty, she has a daughter. So this technique, this is because of surrogacy. Okay, surrogacy means the couple, the female is unable to bear the child, so she will choose another lady who can agree to carry her child, right? Then what are the various problems related with the art? See, it requires a high precision handling. The techniques require that it is extremely precision is required by specialist professionals, or you can say experienced expensive instrumentation is required. तो ये जो technique है इसमें experts need to handle all the details, and expensive instrumentation is required. So this facilities are only available in few centers all over the India. Secondly, there are certain emotional, religious and social problems which are associated with these methods. Since the ultimate aim of all these procedures is to have children. So in India, we have so many orphans and destitute children which would probably not survive till maturity unless they are taken care of. So I would say in India, legal adoption is the best method for couples who are looking for the parenthood. So we should go for a legal adoption, and this will provide you can say mother or the parents to a child who was otherwise destituted or orphaned, and this will in turn fulfill the desires of parenthood for those couples who are unable to have the children, right? So with this topic, I finish this chapter. Now dear students, you must make notes of this topic, and if you've already done, just revise the chapter number 4 thoroughly. Revise all the question answers. This is again a most important chapter. So revise all question answers thoroughly, all your true, false, correct the following statements, everything you should revise. Okay. Okay, so with this, we've finished this chapter, right everyone? Right. Okay, bye everyone.